Good afternoon. Welcome to day 261 at the St. Clair County EMA office, where we bring you the latest information on the COVID. Joined here with Chairman Mark Kern again today on this Sunday afternoon, and Barb Holt, Director of the County Health Department. Barb, you have the numbers.
Yes, thank you. Good afternoon, everyone. Day 261 of our COVID briefings, and thus far St. Clair County has tested 157,147 folks. And that means an increase of 1,815 tests since yesterday have been reported. That means and it also shows that we have 251 positive tests to report for today. Of those, we have both males and females, under 10 years of age, up to 100 years of age. That makes our daily positivity count 13.8% for today. Negative totals are 142,367. We're very sad to report we have 2 new deaths to report in St. Clair County for a total of 250. One was a male in his 60s and a female in her 90s, and both have unknown health conditions. Again, our thoughts and prayers go to their families and family members. We have 12,135 that have completed their 10-day isolation period. Statewide, we have 10,431,018 that have tested. Of those, we have 720,114 positive. That's an increase of 7,718 statewide. And unfortunately, deaths. In the state of Illinois, we have 57 additional deaths to add for a total of 12,193. And again, that number keeps growing every single day, and we just, this virus is here, and it's very, I think the chairman has said before, it's very sneaky, it's very virulent, it's everywhere. So folks, we can't stress this enough, because we sure don't want to be part of these statistics. Hospitalization numbers, again, these continue to be very high. St. Clair County hospitals are reporting that we have 100 patients in the hospital with COVID-related illness, and of those 100, we have 7 on ventilators. Region-wise, we have 227 patients in the hospital with COVID-related illness, and 27 of those are on ventilators. Again, very, very high numbers. As far as congregate living centers, we will report just those additional cases that we have. And at Mercy Rehab Care in Swansea, we have 1 additional case for a total of 29 cases and no deaths. And at Cedar Ridge in Lebanon, we have 6 additional cases for a total of 130 cases and 16 deaths. And again, testing is available at Jackie Joyner Kersey Center and several other places 7 days a week. Next Friday, December 4th, we'll be at the fairgrounds in Belleville from 10 to 12 and 1 to 4 for walk-up testing. And then the December 8th and December 9th, wow, it's going to be December already. Holy Toledo. December 8th and 9th, we will be at McKendree University from 8 to 4 both days. And that is both a walk-up and a drive-through at McKendree. So with that, I will turn it over to the chairman, sir.
Thank you, Barb. For people who may have messed up over Thanksgiving and got together with more people than what they should have, this testing is a good idea. Mm-hmm. A few days after you had your issue, if you go out and get tested, it will help to define whether you have the virus and allow you to quarantine, keep it away from those who have immune compromised situations or the elderly. This is something that we have to remember. What we do affects others. And if you can take advantage of the testing that the health department is working on, we encourage everyone to do that.
Absolutely. And you may not have symptoms immediately. I might take 2, 3 to 5 days or so to show any type of symptoms. And so again, anytime through that 14-day time frame after you've been exposed, you may come down with symptoms, or you may not, and you can be still a carrier and be asymptomatic. So we'll talk more about that at the question and answer session too.
Great. Thanks, Barb. Well, let's look at the zip codes today. In 62201, we go up 8 to 375. 62204, up 5 to 241. 62205, up 5 to 373. 62206, up 20 to 728. 62208, up 11 to 845. 62220, up 13 to 1,035. 62221, up 34 to 1,387. 62223, up 14 to 914. 62226, up 31 to 1,570. 62232, up 3 to 483. 62240, up 1 to 74. 62243, up 3 to 303. 62254, up 6 to 492. 62255, up 2 to 34. 62257, up 7 to 136. 62258, up 9 to 545. 62260, up 3 to 331. 62264, up 5 to 158. 62269, up 34 to 1,508. And 62282, up 1 to 32. As Barb said, 251 new positives in St. Clair County today. Testing numbers increased by 1,815, which brings our daily county positivity to 13.8% and takes our rolling average to 13.5%. The state today pegs our regional positivity down a bit to 13.9%, and that's because Bond County at 13.1%, Clinton County 12.3%, Madison County 16.7%, Monroe County 9.8%, Randolph County's at 14.2% today, St. Clair is at 12.3%, and Washington County is at 36.4%. Herb, question and answer day, huh?
Yes, we are, and Brian has got the day off, so I've asked our operations manager, Mr. Randy Randolph, to fill in today. And Randy, you have the questions.
Yes, I do. I'll start with Barb, as the majority of the questions are usually health department related. Sure. The first question is, I heard that hand sanitizer should have a certain percentage of alcohol for it to be effective. Some of my hand sanitizer has such a low percentage of alcohol. I use it religiously when I'm out and about and can't wash my hands. Thank you.
Typically, they recommend 60 to 70% alcohol content in your hand sanitizer. And again, if you're out and about and you don't have a chance to wash your hands, using any type of hand sanitizer is helpful. But nothing is better than the good old-fashioned soap and water. Washing your hands for at least 20 seconds is the best.
Very good. Thank you. I tested positive for COVID-19 after waiting 7 days to get my test results. It has now been an additional 5 days since I got my positive result, and I have yet to be contacted by a contact tracer. I feel fine now, and my symptoms have been gone for days. When do I get to leave my house, and why hasn't anyone called me?
And again, we apologize. I know the labs are behind. We're trying to keep up with contact tracing of all the cases. And truly, you're right. If it takes 7 days to get your test results back, technically, if you're positive, you're in a 10-day window. We're trying to make sure we reach out to everyone, but we're prioritizing folks to get to those high-risk individuals if we have to first. We have 30-some folks that are contact tracers at the health department just for St. Clair County. So we're doing the best we can. And as you know, and if you've seen the last couple of days, we've just been swamped with cases. But if you need a letter to get back to work to show that you've completed your isolation period, please feel free to call the health department and we'll get that updated with you.
Very good. Thank you. The next question I'm going to read is actually 3 different questions combined, but they're all relate to the same thing. At what point should schools go full remote? I teach middle school in St. Clair County. The numbers are higher than ever, and the adolescent teen demographic is extremely concerning to me. I feel like school boards are not listening to us. Many teachers are scared to return this week and to continue as is through the holiday season. And then also, with the number of cases increasing and likely to do so over the next couple weeks due to the Thanksgiving gatherings, why hasn't the health department recommended all schools go remote for 14 days? They made recommendations in the fall when the numbers were not this bad. And then third and finally, do you have a threshold of a point we need to be at for you to recommend schools go fully remote as you did in the fall?
Okay, very, very good questions and very obviously concerning questions. Our positivity numbers are going up, and it's all age groups. At the beginning of this COVID pandemic, we saw it in the older populations, and now it's moving down to pretty much every age group. We have not specifically seen large numbers of outbreaks associated with a school setting. We've seen outbreaks, or we've seen several positive cases within schools, but to be an outbreak, they have to be related to each other. We're seeing a lot of folks that it may be transmitted to the child because of school sports or an adult bringing it home or from work, and then the child is either a case or quarantined because of that. And obviously, it's a tough question because, students need their education. And, there's a lot of debate and a lot of research back and forth. Is it better to, have it remote? Schools have several options. You can have it totally remote, or they have different hybrid types of courses for your children. So schools have several plans, and are trying to do the best they can to provide this very, very important education to the students. But on the other hand, obviously, we need to protect our children and keep them safe from the COVID virus. So we're in contact with superintendents and the Regional Office of Education, each of the schools, the principals on a daily basis, trying to come up with best recommendations that we can. Ultimately, for a school to go to full remote is up to their school board and the superintendent for that district to make that decision. Again, each school is kind of different in their size, their shape, their number of students, their population, how far they can spread each other out. So it is a local decision with the schools, but we're constantly in contact with the schools to try to help them make the best decision.
Okay, thank you. And along with that also was the question, are there metrics being used across the county to determine schools staying open for in-person instruction? If not, why isn't this decision made by the Regional Office of Education or the St. Clair County Health Department? Right now, for example, we have Belleville remote and Muscuda in person, despite many people living in Belleville and going to school in Muscuda. Leaving this decision up to the individual schools makes little sense. So that kind of goes with the answer
Sure.
that you just provided.
And just a little bit more with that too, when schools decide whether or not to go to remote, another issue is not in addition to how many positive cases we have, but are those cases within their staff, their workers at the school? Do they have enough staff to provide school services other than remote? In addition to the janitors and all the employees at the school. So are there sufficient staff, not only teachers, to provide services to those schools, even if they have to be quarantined for 2 weeks? So all that needs to be, reviewed and evaluated by the school, the superintendent, and the school board.
Okay, thank you. There was a report last week that the CDC was thinking about shortening the 14-day quarantine, but I haven't seen anything more or new number announced. Has there been any change?
At this point in time, there has not been a change, and we would go by CDC and along with IDPH guidance. But we have heard the same thing, that they're evaluating whether or not the 14-day time frame needs to be shortened. And as soon as that is official with CDC and Department of Public Health, then we'll enforce it too. But at this point in time, today, it's still 10 days for isolation and 14 days for quarantine.
Okay, thank you. This is another kind of two-part or two questions in one. I know you have probably answered this before. What is the hospital capacity in St. Clair County? Thank you for everything you guys are doing. And then secondly, what is the plan in case the county's hospitals reach full capacity and there aren't enough beds for everyone? Are field hospitals being considered, and does the county have the resources to build them?
Again, good questions. I don't know if you had a chance to see both Mike McManus from Memorial Hospital and Patty from St. Elizabeth's Hospital last week talking about this specific thing. I think that was Monday and Tuesday, I believe it was last week. And looking at plans, because if we keep up with these rates, I think Mike had said that, we'll be at the max capacity by middle of December. And these are not meant to be scare tactics. These are actual factual truths. No one wants to make the decision at the hospital saying you can come in and you can't. So they are working on different plans, and that's why we're begging and pleading with folks to please, follow the regulations. Stay home. Don't go out if you don't have to, or make limited trips when you go out, because the virus is out there. It's spreading quickly, and it's rough. It's rough on all kinds of ages. From a week or two ago, we had a baby that was a week old that tested positive. When children are born, their lungs aren't at full capacity versus, 20-year-olds, 40-year-olds, and 100-year-olds. It's everywhere. And so, yes, there are plans being made on how to address capacity. Unfortunately, it's everywhere. It's both in Illinois, it's in Missouri. Historically, we're able to kind of transfer to different hospitals within our area to help each other out. And with it being everywhere, especially in Missouri and Illinois, all across the United States, that option isn't possible. So yes, both the chairman and Herb, and we've been in contact with both the hospitals, looking at different plans on how we can address this very issue. And we're working on coming up with that.
Okay, thank you. Where can we find current info on pop-up COVID-19 testing events besides your Facebook page?
Again, on our health department website, the health.co.st-clair.il.us, and we'll have that up on the screen later for you. On our health department website, there are all the local ones, and on IDPH's website, dph.illinois, as well as the Facebook page for EMA, our county website, we have, and we always update those testing sites that are available for both the pop-up clinics and then the standalone that are here 7 days a week.
Okay, thank you. The next question is, would it be possible for the health department to explain and perhaps make a graphic that explains isolation and quarantine periods? There seems to be no consistency between health departments in Region 4. One tells people 10 days from onset of symptoms. One says 10 days from a positive result. Also, for household members of someone is positive. I think people still don't understand the difference between isolation and quarantine, and that a negative test means they are good to go. We really need consistency throughout the region. Thank you, Team St. Clair, for always doing such a thorough job and for working so hard for the citizens of St. Clair County. You are greatly appreciated.
We appreciate that. It's nice to get thank yous every once in a while too, but we appreciate that. Isolation and quarantine, one way to remember is with isolation, think of I. If I have the disease, I need to stay away from people. Quarantining, you want to keep everybody else away from you so they don't get sick. The CDC and the state of Illinois have the same guidelines to follow. It's 10 days if I am positive and that I need to stay away from people. Sometimes what's confusing is if you're asymptomatic and you go get tested, it's 10 days from the date you're tested because there's no symptoms. So I test on one day, 10 days, and I'm positive 10 days from the date you test. If you have symptoms and you go get tested 2 days later, it's from the day you start having symptoms that you want to isolate from. Even though 2 days later is when you tested, you start from the date you have symptoms. So that's why the 10 days could be a little bit different between if you're asymptomatic from the time you start having symptoms versus if you just go get tested. And again, on the quarantine, folks, it's when you've been exposed and 48 hours from the time the last time. The 48 hours is for those you've been in contact with. So the 14 days is from the last time you've been in contact with the individual that was positive. So again, isolation is I need to stay away from people if you're positive, and then quarantine, you want to keep them away so they don't get sick.
And what's the 48 hours again?
The 48 hours is from the time that, let's say, an individual tested positive, you go back 48 hours to see who you may have been in contact with, and those are the folks that get quarantined. So that's what the 48 hours is. So if you're symptomatic, you go back 48 hours when the symptoms started. If you're asymptomatic and you test positive, you go back 48 hours from the date of your test.
Great. Thank you.
Awesome, thank you. And this next question kind of goes in line with the question that the chairman just posed. My family was with an individual on Wednesday evening who developed symptoms on Saturday and then tested positive on Sunday morning. Will we need to quarantine since our exposure was more than 48 hours prior?
And again, following those rules, those are close. And how much contact did you have with them? By definition, it's 48 hours. If you were in close contact with that individual, again, as we say, it can take several days for you to become ill. Even though the rules say quarantine if within the last 48 hours you've been in contact with them, that's pretty close, and it's better be safe than sorry.
Okay, thank you. Does the health department verify schools are following IDPH guidelines?
We work closely with schools. Schools have a lot of guidelines in place. We know they have a lot of plans in place to do the best they can to make sure that they have 6 foot of social distancing and that people are wearing masks and so forth. If we get complaints about schools, which we have, we follow up with the school, with the superintendent, with the principal to make sure that, hey, did somebody just kind of slip or didn't follow the rules? But we keep in contact with them as well.
Okay, thank you. When is the health department going to start pulling licenses on repeat offenders on restaurants that blatantly ignore the closure orders? I've reported several of the same ones weeks after weeks, and many are your name brand ones, and they're just laughing at the mandate.
Yes, I agree. Several facilities are not following the guidelines, the mitigation guidelines. Absolutely. We've gotten several complaints and we respond to all of those. Obviously we don't want to make this punitive. If people don't abide by the rules and people get sick, that's punitive to the poor folks that may have gotten ill. The facilities are we give them education on what the rules are, to have 6 foot social distancing, to no indoor dining, to ensuring they're wearing masks, to crowd capacities and so forth. And we educate them the first time around. We also notify the local municipality, the police department, the mayor's office, whoever the liquor commissioner is for that area, and the local law enforcement to advise them, because as the executive orders read, we're all responsible for enforcing these mitigation efforts on a local level. Again, we understand we don't want to be punitive, but folks, if you get sick, that's very punitive. Your health, there's nothing worth more than your health. For those second complaints, we're writing violations. We're working with the state's attorney's office, and permits will be pulled. Liquor licenses can be pulled by the liquor commissioner. Typically, that's the mayor and or the chairman. And law enforcement can issue citations with fines for that municipality to enforce the rules. And the other piece of this, folks, is not only for the businesses, but don't go. Don't create the crowds. Don't put yourself in that position to be part of the problem. As Herb has been saying for 261 days, be part of the solution, not part of the problem. Order carry out, support those facilities. We understand people are trying to have a business and survive. We understand that totally. But the spread it's getting out of control, and there are several facilities that are blatantly abusing that, and more follow-up is coming along with citations and licensures.
Okay, very good. Thank you. The next person asks, where did you say the dining guidelines are posted for the public to review and understand as to why some restaurants can provide service while others cannot? Again,
As we said, it's no indoor dining. carry out only, or carry out is possible. They can have, or you can dine outside. Obviously, the weather is not being very cooperative with that. If they have tents, 2 sides of the tents must be open on the outside to be considered open dining. And all these guidelines and information can be found in an easy website that has a lot of information to get to is the State of Illinois website, which is DPH, Department of Public Health, dph.illinois.gov. And there's information on what the rules are, what the percentage rates that the chairman and we report on a daily basis for all the different regions, for our county, what the rules are, what the mitigation rules are. dph.illinois.gov has a lot of great information.
Okay, and I think also DCEO, the Department of Commerce and Economic Opportunity, has specific guidelines for different types of industry that our viewers could go and look on there if they have a specific question related to an industry.
Absolutely, for different businesses and industries and, outdoor movie theaters and things like that. There's absolute DCEO.
Yes, thank you. The next person wrote, people would get tested more if we could get the rapid test here. Are they coming?
There are rapid tests available, and the difference between rapid tests and the ones that take longer, the rapid tests and the ones that take longer, called PCR tests, are both accurate for positivity. So if you test positive with an antigen or a rapid test, and you test positive with a PCR, you're positive. If you test negative with the rapid test, there's a chance that it's a false negative. We've had several reports of individuals that have tested negative on the antigen testing, but they also had a PCR test and they were positive. So again, the efficacy, is very much more. The efficacy is much more reliable in the PCR test, but they're both reliable if you're positive. Okay, I know everybody doesn't want to wait for them. I totally understand that. People got to go to work. You need to know, what do I do instead of waiting 5 to 7 days for these tests. Companies are working on these antigen tests to be better, more efficient, and more effective. So they are coming, but if you test negative on a rapid test, please follow that up with another test. Don't be absolutely sure that you're negative. And again, with tests, that's only for that point in time. If you test negative, that you could become exposed tomorrow or the next day.
Okay, thank you. The next person asked, when will plans or details be announced for the vaccination points of distribution? Will first responders be able to receive it and administer it in-house if they have qualified personnel that can do injections?
Yes, we're working with regional-wise, with IDPH, the hospitals, the local health departments on coming up with plans for distribution of the vaccine. The priority populations that will get the first doses once they are approved and sent out, obviously, will be our medical providers, the hospitals, the doctors, the nurses, but along with the folks that work at those hospitals and their employees, the folks that clean and provide the food, they all need to make sure that they are safe to offer those medical services. And then along with that, the guidance is coming from CDC and Department of Public Health as who those priority populations are. We know, again, medical providers at the top of the list. Those second and third, you hear different, there's not an absolute that has been decided yet, but it's between first responders and those that are at high risk, those vulnerable populations. One thing we got to remember, when the vaccine comes out, we won't have enough to take care of everybody at the same time. They'll be coming out in limited portions, so the vaccine will be distributed to those priority populations in small doses as we move along. So we won't get everything we need for St. Clair County for our priority populations right off the bat.
Okay, thank you. The next person asks, how much contact tracing is going on at St. Clair County?
Again, we have 30-plus staff that are working on this. Not only St. Clair County Health Department, but we have 2 health districts, health agencies. We have Eastside Health District as well that are working on contact tracing. We're doing the best we can. Staff are working 7 days a week, following up and calling individuals that are positive to make sure we're trying to get in contact with those folks as soon as possible.
Okay, thank you. The next one is a long question, but it does relate to some questions that were asked earlier. Why is Muscuda School District allowed to be in session with in-person students when surrounding districts have gone remote? Doesn't this inhibit the stay-in-place order? Also, teachers are afraid of exposure because students declared travel and visits from out-of-town guests prior to the holiday. How can teachers be forced to be exposed? The school board gives no inclination that it will slow the addition of students in person. Teachers are also not notified of a student in their room tested positive, even anonymously. We find out from the student, usually, who emails the teacher. They say our distance in the classroom is enough as long as we are masked. Is that true? Some teachers don't feel safe because of their family members at home who are high risk. What can be done?
Again, very good questions, and there's a lot of different facets to this. One of the things I do want to point out is with the governor's mitigation orders, schools are not included. Schools are allowed to continue as they need to on a local level. That's a local decision, as we said earlier, by the school board for them to decide. As far as as far as knowing within the school of who is positive, again, this is medical information, and according to HIPAA, only those that absolutely need to know are told. So, for instance, a teacher may be told that you have a student in your class that's positive, but only if the student is removed from the class, and anyone that needs to be quarantined that was within 6 foot for more than a total of 15 minutes. So again, according to HIPAA, we don't give names. We only let people know that absolutely need to know. If the parents choose to tell the teacher and the school that their child is positive, that's their right to do that as a guardian for that individual. Or if another teacher wants to say, hey, I'm positive, and they want to tell somebody else, you can tell your own medical information. But for someone else to reveal that, that's against HIPAA violation or HIPAA rules, so we cannot do that. And then finally, so again, the distance in the classroom, as we said, different classrooms are set up differently. Some of them have teachers that move from classroom to classroom versus students that stay in the room. All those scenarios are different, and we, again, talk to schools on a daily basis of trying to make sure that they are isolation and quarantining the appropriate number of people within that classroom.
Okay, thank you. And the final question for you, Barb, is with the increasing COVID rates, IDPH is encouraging people to work from home. Restaurants and bars closed and public places reduced to 25% capacity. Why do schools where attendance is more than 25% and students are eating inside still open? When does the safety of public health get taken out of school board's hands and placed in the hands of the public health department who is educated on making these decisions?
Again, as I said earlier, the mitigations, the mitigation guidelines or the mitigation orders put out by the governor do not specifically address schools. Schools are allowed to stay in session. However, schools through Department of Public Health and Illinois State Board of Education has a 70-some page regulations book on what they need to do to make sure the students are as safe as possible within the classroom to protect them from COVID. They're required to be tested by their parents, and the parents sign off that their child is not sick and they don't have symptoms. They get their temperature taken when they come into school. They're required to wear their mask and the 6 foot of separation. So again, and we haven't seen the outbreaks because school is open. We've seen cases in schools, but not outbreaks specifically related to that school. So it is a tough decision, and it's up to the school board and the schools themselves to determine if school needs to go full remote or not.
Okay, thank you very much. We'll switch over to Chairman Kern for his questions. And Chairman, This is kind of two in one. I want to know what is being done by our county leaders to enforce the guidelines. These leaders answer to someone. Our hospitals are full and it's beyond time to do something. Asking please isn't working. We need results. And then another person had posed a similar question. What are we doing about those not following Tier 3 mitigations?
So I agree that we need results. We need these numbers to go down, and so this is really a multifaceted response to trying to drive these numbers down. So I'd say that every day when we do this live feed, we gain support from the public, we gain support from the businesses. I will say that the vast majority of businesses are complying, they are trying, they are making people wear masks. The vast majority of the bars, the restaurants have closed to indoor dining. They understand and they want to comply. The enforcement team in the county, along with my office, is Barb Holt, the health department, the sheriff's department, and the state's attorney's office. And together, we work to try to gain compliance. So Sheriff Watson has his deputies out, and they counsel places if they find that they're not complying. But when people just decide they're going to defy the executive order, they're going to defy the law, they're going to say that they just don't care about the general public and the welfare of the public, then action does take place. So as Barb said, the health department is in charge of food licenses throughout the county. So those food licenses are in jeopardy in the county and citations have been written. In the unincorporated area of St. Clair County, those liquor licenses are handled by the St. Clair County Board office, and there are a couple establishments that have put their licenses in jeopardy. Actions are occurring, and that enforcement is necessary. Unfortunately, it should be easy for people to take a look at these numbers, and frankly, their insurance companies are telling these establishments, we're not going to cover you if something happens if you're not complying with the law. But even that hasn't gotten through to them. So I think stronger action will take place for those places that are jeopardizing the health and safety of the public in St. Clair County, and we'll continue to enforce those guidelines. But we really want to ask people to comply. If the public boycotted those establishments and said we're not going to go there, they wouldn't be open because they wouldn't have anybody sitting inside at the bar not wearing a mask. They would be those people would be home, and that establishment would be closed because there would be no business there. So it's really up to everyone. But I will say that the laws give us the power to enforce things if those business owners don't want to comply, and that's what's going to happen.
Okay, thank you. The next person wrote, retail is limited to 25%, so how can Target, Kohl's, and others be packed well beyond occupancy of 25%, and again, no repercussions?
So those places should be complying, just like bars and restaurants. Those retail operations are under the executive order also, and the mitigations that are required. If you see places that aren't, let us know. We'll turn them in to the municipalities in which those particular stores are located. And I would encourage you to call your local mayors, call your local officials, and let them know that these places in their communities aren't complying, and ask them to make them comply. After all, these are our communities. These are communities within which we live, and our friends, our relatives are here, and we want to make sure everyone's safe. The only way we can do that is if we gain compliance with the mitigation efforts that are ongoing. These numbers don't lie. Anyone that's out there that's saying that COVID isn't real hasn't been listening to this live feed every day. These numbers are increasing incrementally at an alarming rate. And if we don't get them arrested, if we don't get those numbers under control, the situation is going to be untenable in our local hospitals. And at that point, the situation is going to become almost impossible to control.
Okay, thank you. The next person wrote, how many taverns and restaurants have been cited in O'Fallon?
So you'll have to call the mayor of O'Fallon, ask that question. As far as we're concerned, the ones that are open should be tagged if they're operating and they're not in compliance. I would encourage a call to the mayor to find out the answer to that question.
Okay, thank you. And final question for you, Chairman, is why is Mayor Eckert making the decision to not enforce restaurant closing mandates in Belleville? City limits such as the Round Table, Abbey, Moores, just to name a few.
So I don't I don't know if he's made the decision. I would doubt that he would make the decision not to enforce. What I would say is that there are many establishments in Mayor Eckert's city and the city of Belleville that are complying, and I think compliance and certainly the requirements for compliance need to be addressed evenly and fairly, and everyone needs to be complying with the executive order. No one should be given special favors. Everyone should be required to follow the law so we can get these numbers down. Any one place that's open is a problem. They all need to be complying in the same fashion.
Okay, thank you. I'm going to switch over to Director Simmons. I have one question that came in for you. The question was, when does the fear-mongering, lies, and stupidity end?
Well, the short answer there is wherever you're getting that source from is I would change sources. If you're, and I would assume that you're not referring to these briefings because the information we're giving you here, as we've said for 261 days now, is the most accurate, up-to-date information that we obtain from not only our local health department, but from the Department of Public Health. As far as any fear-mongering, maybe that's what some of you need. Maybe you need to have some fear instilled upon you because, as the chairman just said, these numbers don't lie. We live and breathe these numbers now for 261 days, and we're going to continue to do that. Team St. Clair is doing an excellent job of helping us share that word out there. We're seeing more and more people every day that is calling and leaving messages here and saying that, when this thing first started, we were skeptical, but as each days went on, as each people have got sick, each of the numbers of people dying, 2 more in our county, it's unimaginable where this thing is going to stop. And it won't stop if the fuel doesn't get cut off from this virus. And as we say each and every day, it's all of us. It's not just one. It's just not yous who don't believe in it. But as far as any fear-mongering and the stupidity, I don't see that here. So I would go to wherever you're getting that source from and then maybe change your source of information.
Very good, thank you. And just 2 comments that came in also. One person wrote, "Thank you, Team St. Clair, for your daily updates and continued dedication. And thanks to all of those that have been tested so the positives can be identified and isolate. A lot of credit must also go to the many citizens following the, I believe they're saying, Tier 3 guidelines. The majority of the county citizens are on board, trying to stay safe and virus-free." And secondly, someone wrote that they were in downtown Belleville Saturday doing Small Business Saturday shopping, and everyone that they saw wore masks and were socially distanced. It can be done and allow businesses to make some money.
Well, a lot of questions, a lot of good ones today. As Barb said, a lot of good substance to them. I just want to comment. Kimberly asked, Herb, what are we doing to protect the mental endurance of your team? How can we help? And it is a lot of mental endurance. It's after 261 days, the staff seems like, every day is just Groundhog Day. But we're going to cope with this. We have said from day one. The other thing I want to point out, there's always a few people on there that want to get in a debate with Team St. Clair. This briefing was started to bring you information. So you're not going to change our mind. We're not going to flip over tomorrow and say, well, you're right, that these numbers are wrong and we've been wrong, because we know they're not. We know that this thing is real. So please do yourself a favor, do the members of Team St. Clair who want to do the best and spread this word and try to stop this virus. It's not going to work. And Team St. Clair, as we say all the time, continue. I know from the messages that you leave, the phone calls that come in, you are getting stressed out, but believe me, this virus isn't.
But so that we leave on a somewhat positive note, the good thing is there's hope.
There is.
So throughout the 260 days that we've been doing this, the treatments for those who have COVID have gotten far better. So when the health department comes here and Barb Holt comes here and says, hey, go get tested, if you find out that you have COVID early in the stages of COVID, it is eminently more treatable than if you let it go on and let the symptoms get worse. So knowing that you have it is much of the battle with COVID. And second, I mean, these vaccines now are starting to roll out. They're talking about early December that they'll be rolling out to certain individuals. They'll be the frontline workers, or those will be decided on who will get those first doses, since they won't have very many of them. But once they start to roll out, then that light at the end of the tunnel becomes brighter and brighter, and we get through this. But we've got to get through December. We've got to get through January. These are going to be 2 very difficult months. And the way we get through it is that we listen to what the scientists are saying, what the CDC is saying, what our governor is saying. We wash our hands, we watch our social distance, we wear our masks, and we follow the guidelines in the mitigation proposals that have been put forth in front of us, the mitigation rules. And we do that, and we'll get through this, and then we'll be able to get back to our lives as they were in March, which really was kind of when this started for us in St. Clair County. We'll get back to that level again.
Exactly. The other number that we talk about all the time is under the age 40, 121 over this last 24 hours. So as Barb said, those numbers are just from all ranges. So please hang in there, and we will get through this. Thanks everybody for joining us today. We'll be back tomorrow for day 262, and we'll be back shortly with Daisy and Cindy to translate this into our Spanish communities. Have a good night.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.